Hello, my name is Abdullah Jamal Baswai. I'm from University IMW, International University of Malaya, Wales. In this presentation, I will discuss about the infographic that I have created, which describe one of the mental disorders, OCD, which stands for Obsessive-Compulsive Disorder, and some of the related disorders. Moving on to the first slide. Now, what is the infographic concept? Now, my infographic provides some general knowledge about the OCD, such as its definition, its symptoms, its type, and its treatments. Now, this knowledge can improve the public knowledge amount of mental disorders, and also it provides some statistics. These statistics give the public some general knowledge about who might the OCD develop at first, and at which age exactly. And also it provides some indirect advices. These indirect advices means that some people may have these types of disorder, but they may not realize that it's a mental disorder. So by reading this infographic, they might be encouraged to go to a psychotherapy and consult them. So they might have this mental illness, and they might be cured from it. Now, starting for the information that is contained on the infographic. Now, an overview. What are the OCD and related disorder? OCD splits into two categories. The first category is the obsession. Obsession is recurring and unwanted thoughts or sensations, and these thoughts and sensations make the patient feel driven to do something repetitively. Now, the action of doing something constantly and repetitively is called the compulsion, which is the second category of the OCD. Now, in OCD, it can be developed on men and women and children. It can be developed at any age, on any gender. Starting with the types and symptoms. Starting with the checking. Now, checking is the doubt thoughts or uncertain thoughts that makes the patient feel doubtness about something that is normal, such as closing the door when someone's leave the home. So when the patient, for example, leave the home, they tend to think more than once, and uh, keeps going back to their home, just checking: did they close their doors? Did they close their oven? Is everything settled down? It's normal. It's normal to check. It's normal to have a doubt. But doing it repetitively and constantly, it means that you have the checking types of OCD. As you can see, the symptom is doing a repeating action. The second thing is contamination. The contamination is when a person fear of contracting illness or spreading germs. The thoughts and the obsessive thoughts make the patient have an anxiety and distress. When the patient have the anxiety and distress, they will try to relieve. So how do they relieve? They relieve it by doing the compulsive actions, such as for this types, uh, doing an excessive amount of cleaning and also avoiding crowded places, because they fear dirt. This is their symptom, their fear of being dirty. Moving on to the number three, which is rumination. Rumination are the core feature of OCD. They are is when a patient start thinking, worrying, analyzing about a particular theme. Now, these themes are not beneficial to them. They doesn't give any value to them. So, for example, if someone is having an exam, he's studying, and suddenly he start thinking, so what will happen if I am rich? And when will I travel? Where will I travel? With whom will I travel? How will I achieve all of that? Now, The problem of rumination is that it makes the patient spend a lot of time doing something that is not useful, and its symptoms, as you can see, worrying about analyzing a specific topic or theme, and at the end, it doesn't give any value. The patient will stop thinking after an excessive amount of time, and will continue his normal job, studying, eating, and other things. And number four is intrusive thoughts. Intrusive thoughts are unwanted thoughts. These unwanted thoughts appear regularly on the patients. Now, for example, if someone just is trying to sleep and then suddenly he starts thinking, what happened if tomorrow I stand in front of everyone and I have to sing? It sounds ridiculous, but this is what type of thoughts they appears on them. It's really ridiculous that they try to get rid of it, but they cannot. This is why it's called the unwanted thoughts. And if you realize, rumination and intrusive thoughts, both of them is about thoughts, thinking. So what's the difference? Rumination happens. Rumination is when the patient starts thinking. They start the action of thinking, and they can end it. They can stop it whenever they want. But intrusive thoughts are unwanted thoughts. The patient tries to resist them, but he can't or she can't. That's why this is the core difference between rumination and intrusive thoughts. Moving on to the treatments. Now, I should mention that the previous types are some general types. There are, of course, other types, and also for the treatments, there are other types of treatments, but they are the most general types. And the first one is psychotherapy. Now, in psychotherapy, there's something called a cognitive behavioral therapy, and this is one type of a psychotherapy, and one of its components, something called exposure of responsive and prevention. So what does that mean? It means that a psychotherapist will bring the patient, okay, and it will let them face what they fear, what they try to avoid. So what's the advantage? What do they want to achieve from that? They want to try to help the patient to develop a way to resist these thoughts, at the end which at the end result in some compulsive actions. These types of this calls the ERP. It happens. It can be done all around the world. And for example, taking a patient with a contamination. So as I said previously, contamination is being fear of dirt. So a doctor, a psychotherapist, will take the patient, will just put them some dirt. It should not be that dirty, even dust. It is just because the people who have contamination just have fear of everything that can make them dirty. So when the contamination, the patient with the contamination being faced what they fear, which is, let's say, dust. Okay, the psychotherapist will start giving them advices of how can they develop a way where they can resist the consequences of these thoughts. For example, the excessive amount of cleaning and avoiding the crowd. So eventually, after this psychotherapist treatments, the patient will be able to again clean himself regularly, just as a normal person, and go out with the people and in a crowded places. Secondly, is the medication. Medication. So for the medication, there are some medication for the mental diseases. This medication, for example, the antidepressants. The antidepressant have many medication for it. Now it's not easy. It's not easy to choose any medication and then start taking it, and hopefully it will be okay. There are some steps that should be taken into account. Firstly, they should make sure that the medication that they choose won't give them any allergy. And the second thing, they can consult their doctors. By consulting their doctors, they will be able to choose maybe the best type for them, the safest type for them. But to make sure the medicine that is being taken is effective, it takes weeks to months just to make sure that the medicine that is being taken is doing something. So sometimes the medication the patient taking it won't affect them at all, so they will have to change. But just after weeks or months, not only days, they will have to wait. Now, the third one is something called deep brain stimulation, DBT, DPS, sorry, DPS. Now, the DPS is a treatment to adults. Okay, now adults, when I'm talking about us, adults, I am talking about people who are from 18 years old and above. So, who are these persons we are giving them the DBS? These people who they were given the traditional treatment approaches, but it wasn't effective at all. So, what do they do for the deep brain stimulation? They plant some electrodes in some certain area of the brains, and these electrodes produce some impulses, and these impulses hopefully can control the abnormal impulses. Now, what is impulsive? Impulses are the things that encourage the movement of the compulsive actions, such as, for example, the hair pulling disorder is one of the related disorder to the OCD. So it's when someone cannot resist the urge of just pulling their hair. So sometimes impulses are being produced when and the person start pulling their hair, and these DPS hopefully can control that. Moving on to the statistics. For the statistics, it's normal that there are Malaysian statistics and worldwide statistics, but there wasn't any recent statistics for the Malaysian and also for the worldwide. Actually, this chart is was taken from a research that research collected an excessive amount of other researches about OCD, and they concluded that the mid-age or the most ages that the OCD occur is at the 14 and a half and 49 and a half age. So as a parent and or even as a teenager, the children, parents can take their children and watch their activities, ask them some questions just to make sure if they have the OCD or not. Okay, now moving on to the related disorder. For the related disorder, this is some general related disorders. The first one is the hoarding disorder. Now, for the hoarding disorder is when someone keep a lot and too much items that are not beneficial to him. Okay, they are unmanageable. They are not worthy to them. They does not have any monetary value. So why does someone have hoarding disorder because of OCD? Sometimes intrusive thoughts. Intrusive thoughts are the unwanted thoughts. So sometimes people think maybe I will need this thing for the future. That's why they start keeping it. Now, if you think about it, what's the problem of keeping something for the future? I mean, something might happen in the future, and I will need that item. I am completely agree, but the problem is these items are not beneficial to them. They are not beneficial to them at all. They doesn't have any monetary values, such as like grocery receipts. How can this be beneficial to them for the future? It's not. This is the problem with the people who have hoarding disorders. Moving on to the second one, which is OCD due to medical conditions. This basically means that some medical condition can develop an OCD. For example, taking the skin picking disorder, which is related to the OCD. Uh, Now, this mental disorder or psychological disorder can also be developed by the medical conditions. For example, the liver diseases and also the anemia. Now, how can the anemia develop the skin picking disorder? It's simply by not allowing the oxygen in enough to reach the extremities, and this will eventually create some itching, which will lead to some skin picking. And the third one is the body dysmorphic disorder. Body dysmorphic disorder is actually a mental disease in which individual keep caring too much about the flaw of their appearance, and they care about some things that are unnoticeable. That's why it's a disorder, because it's okay to take care of your body, but it's not okay to think too much about unnoticeable thing that won't affect you at all. Sometimes the people with the dysmorphic disorder uh, tend to avoid crowded places or even meet people because they're afraid that these unnoticeable places will give some bad ideas uh, about their characteristics. So they tend to be scared just to face the people. That's why it's somehow related to the OCD, because as taking an example of a contamination is fear of also being at a crowded places, but because of dirt, which is different, but the process, the reasoning is a bit similar. Fourth one is the hair pulling disorder. Hair pulling disorder is when someone can't resist the urge of pulling their hair, and when we're talking about hair, it can be the head, the eyebrows, the eyelashes. Now they can't resist of pulling them. And also taking an example of the OCD is in intrusive thoughts or unwanted thoughts. Both of them, the patient try to resist, but they can't. They just can't. This is the problem. Now these are the related, some common related disorders. Moving on to the maybe the before last slides. How can the infographic raise the awareness about the mental health for the public? Now, as I stated at the beginning of my presentation, the infographic can give some general knowledge about the OCD, which eventually will let people to read more about mental health and also read more about other mental diseases because they might have it, but they don't know. These mental diseases, psychological diseases, affect their lives, but and they can't treat it. They are treatable, but they don't know about them. So by providing the infographics, people will be more motivated to look for them. And lastly, but not the least, these are the references. Here you can, the third one where you can find about the research about the statistic that where I bring the chart. The second one is where most of the psychological information brought from. Thank you very much for listening. Have a nice day.